sicker, mostly because of the designated medical underserved area requirement of health centers. So they're in areas where people haven't had access to care or are already marginalized by their situations. They're living in public housing, or they're homeless, or they're a migrant farm worker, or they're just somebody who doesn't have health insurance and probably hasn't had health insurance their whole life. So they are, on the whole, a sicker population and have other greater socioeconomic and social determinant factors going into their health care besides their just access to insurance, which is also very important, that need to be considered. And strap health centers with a lot of burden and responsibility, and really, I think, affirm its very important role in our country's healthcare system. Certainly in different states it looks very different. In certain states, I'm from North Carolina, we have a large migrant farm population. In Southern California, that'd be the same. So even in the same state, these health centers might vary a lot depending on what the patients need and what sort of programs they're running. And in terms of access, we compared Medicaid expansion states and non-Medicaid expansion states, and did various tests to see how health centers were different in different resource settings. And they are, and their budgets are different. And it looks like there's a greater proportion of HRSA 340B programs in states that are more resourced, and maybe greater access to care in some of those states that have more health centers for people without insurance.